If you were to ask me about my whole life, I really feel like I'm like 100% better, and I'm not just saying that, but I feel like I got my life back. When you saw me the second time, I just feel like I'm like myself again. The months after that surgery, I was depressed. I was like so anxious. I just couldn't like sometimes get myself out of bed. I felt like I was gonna lose my job, my relationship, like, and I really mean that. It really was like taking over my life, and I didn't feel like myself, and I feel like I do now. So I really feel like even like the little bit of pain that's like, it's not even pain anymore, it's like honestly just like a discomfort here and there that may be at like an 80-90%, but I just feel like overall like I feel like a new person.
You feel like a new person. So that's like 100% to be a new person.
Yeah, I really do. I feel like I have my life back. I'm happy again. Even when I do feel the discomfort, I'm like, it's okay, it's just 20 minutes, it'll go by, and then it'll come.
And that bladder is, when you said it's just like 80-90%, you're talking bladder, you feel better 80-90%.
Correct.
Is that what you were saying before?
Yeah.
Congratulations. I can keep digging in because I just love these details. It's phenomenal. I'm so happy for you. Hello. Are you one of the millions of people around this world who are living with, suffering with interstitial cystitis, a chronic, painful bladder syndrome, overactive bladder syndrome? Have you visited many doctors and they're not giving you the answers, besides a diagnosis, but answers to help you stop the pain, to help you stop the urgent, frequent trips to the bathroom, whether it's day, multiple trips and none at night, or it's at night, multiple trips and not as many in the day, or it's both. You're constant, 24 hours a day, 7 days a week going to the bathroom. If you are one of those millions of people around this globe who are suffering terribly with interstitial cystitis, and you've already had a cystoscopy, you've already tried medications, you've already tried pelvic floor therapies, you've already tried surgery, you deserve to hear what this woman, Cindy, has to say, and you'll see this in just a few moments, what she has to say about the incredible journey that she's been on. She's got incredible relief. 23 years of suffering with her overactive bladder interstitial cystitis symptoms. If you're one of millions of people, listen to this. I'll be back in just a moment. Your condition was interstitial cystitis. That's what you were diagnosed with. Can I ask your age now?
I'm 31.
31, okay.
I've been dealing with this since I was 8 years old with the symptoms.
Constant throughout life. Constant.
And was told it was just like recurrent UTIs up until I was 18, and then I was officially diagnosed with 𝐓𝐇𝐈𝐒. It was very inflamed inside and red, and kind of like he explained as like just bare. Like it seemed like it was just very raw.
Headaches for how many years?
It was probably within the last year that they became more frequent.
More frequent. You had cramps in your calves.
Yes.
You had cramps and spasms in the fingertips and toes, right? And you had shortness of breath was another one of your symptoms, right? Insomnia.
Yes.
It kept you up at night.
Very bad.
Very. And you couldn't have intimate relations. It was too difficult. On a scale of 1 to 10, if 10 is the worst pain you can imagine with the bladder, and let's say 0 is no pain, what was it prior to coming in here?
It was like a 20.
Like
it was
a 20.
like unbearable. Like I couldn't work. I couldn't sleep. I couldn't really like hold any relationships because it was just like a constant like dagger in my life that like wouldn't go away no matter what I did. After I had a surgical procedure with a urologist in the area, she was recommended as like a specialist for 𝐓𝐶. She said she saw like ulcers inside my bladder, and so she was able to burn them, but that just like made it
worse.
100 times worse.
So if a 20 is the worst when you came to me of severity, what was it prior to that surgery?
Probably a 10. It was bad, but it was manageable with like medications.
And the doctor who did the surgery, when you came out of the surgery and you said something's wrong, it's getting worse, what did she say?
She said we just had to give it time, that it could take up to 6 months for everything to heal. And I just kept calling her and telling her like it's just I can't live like this, like I don't know what to do. And I started getting scared because I'm like, I'm taking all this azo, I know it's not good. So then she recommended doing another surgery, and thank God I found you right before then.
Thank you.
Yeah.
Yeah.
You feel like you just have to go really, really bad all the time, even if you don't have to go. Burning and aching and just pain, like my whole like lower area is just felt like so sore. Like after that surgery, it was like I couldn't put anything down there. I was like, sometimes water would hurt. It was that raw 24/7. When I would pee, it would burn. Like I would cry. Like I would literally sit down and just like cry every day. Like sometimes I would have to pee in like a really hot bathtub. It was the only way that I could like manage, because it was just like the worst sharp shooting pain. I don't know how to explain it.
You literally had to get into a warm bath and pee in there.
Yeah. Like
while you're in there, and then drain the tub.
Yeah, it was really bad. You can't go to work like that. You can't like really do anything. It just takes a toll on your life, and it just like really becomes like the center of your life, and you can't like, there's nothing, like, to be told so many times like there's just nothing we can do, or like just have to wait. It just like then becomes like a mental thing where you're just like, I don't know if this is like ever gonna get better. Like it's very defeating. I had seen so many specialists at this point, and they've all told me the same thing, so you kind of just start believing it too. When I met you, I felt like such a sense of relief, because I was like, this is what I've been talking about. Like I feel like there has to be something that's causing this, you know, and it doesn't make sense to me that all we're doing is just kind of like putting a Band-Aid on it, because it didn't seem like it was ever going to get better that way.
Mm-hmm. And now from a 20, what is the quality of the pain right now?
Maybe a 4 or a 5.
Now it can last for, you told me, I think at a 4 or 5, maybe 20 minutes.
Maybe 20 minutes.
And it goes away without an
away.
azo, without
Correct.
any other support, without any other med.
I mean, I was up every hour. Now I can like just sleep through the night.
Yeah.
Like the first time that happened, I was like, oh my God.
How many years?
I forgot what it's like to sleep,
sleep.
7-8 hours.
There was about 15 months of no sexual relations because the pain was...
It's just horrible. It just felt so sharp and painful. You really like brought that aspect of our relationship back, where we feel like normal again. And I love how here it's so personalized. It's amazing how much like little things that you don't even think about may be hurting your body and you don't know.
Mm-hmm.
So I think that this way it really is like getting down to the root of what's causing this whole thing, and I trust it wholeheartedly. And I would tell you to just do yourself a favor and don't listen to what other people say, even if they tell you that you can't be healed. Like, advocate for yourself, believe it, because I mean I'm like a proof that it can happen. I'm just happy I didn't give up, and I'm happy that I like kept trying and I found you, thank God.
Thank you. And I will see you on the other side of this video, where I share with you the kind of exam findings I discovered with her. Congratulations.
Thank you.
It can happen for you too. Wow, isn't that just incredible? She suffered for 23 years. She went to a top surgeon in a top university. She had surgery to burn off ulcers in her bladder, and her pain doubled. It went from a 10 in severity, where 10 is the worst, to a 20. That is not good. But what is great now is her pain is reduced dramatically. Also, which you're going to see her testimonial in full, incomplete, at the very end of this video. But also her headaches that she suffered for a long time, they're gone. Her shortness of breath after one treatment with the work that I offer in my rapid health restoration system that we'll talk about in a few moments. Her shortness of breath decreased by 50% in her first treatment. Her burning that was happening with intercourse, she couldn't even have intimate relations with who's now her spouse, boyfriend at the time. They couldn't do anything because the pain was so severe. Her depression, her anxiety was so severe. We'll talk about that later. The frequency at night and the frequency in the day has decreased dramatically of her trips to the bathroom. She no longer actually at nighttime has to go. Her insomnia has been solved. The cramps she also had in her calves are gone. Her fingertips, her fingers would cramp, her fingertips are cramped. That symptom is gone completely. My name is Dr. Lonnie Herman, and I'm here to share with you about my rapid health restoration system and give you a different insight, a different unique point of view of what drives these different overactive bladder and interstitial cystitis symptoms that may not appear in a laboratory, whether that's a urinalysis, it may not appear in a blood test, it may not appear in a cystoscopy. Besides, they can tell you they have an irritated, swollen lining of your bladder. They can tell you that, but they can't tell you what's causing it when they don't see, with a biopsy running to tell you that there is a staph infection or a viral infection. If they don't find it with a biopsy, besides saying that you have interstitial cystitis, if they don't find infection in, which is very common, in a urinalysis, or maybe they did find an infection in one urinalysis test, and then you follow up with an antibiotic, and then after the antibiotic round, and you're still suffering with urgent trips to the bathroom frequency that's driving you insane. And this follow-up urinalysis, they show that there's no more infection. And then the doctor may either keep you on the antibiotic, because they have no other pill to give you to try to give you relief from the symptom, or they can recommend surgery, or they can recommend a pelvic floor therapy. That doesn't solve the condition. We're going to look at a whole different point of view, okay, to give you some of the knowledge that you need. Knowledge is power. A patient who understands what's going on has a better chance of restoring their health and stopping the insanity of the interstitial cystitis than a patient who doesn't understand what's going on. This information I'm going to share with you is going to give you a much different point of view than what you've heard from your other doctors. You've got to understand something, and those doctors have tried for you, and that is great. What's not great is they haven't been able to give you the relief from your condition, but they've tried. And doctors who are urologists do understand urine. They may understand the bladder to some degree. Sometimes, not all, I don't know all the physicians around the world, so I can't point any fingers at any one particular physician. Generally speaking, though, many of the urologists who I've gotten to discuss interstitial cystitis with, they don't understand what would cause what they call a neurogenic bladder disorder, a nerve-producing bladder disorder. They don't understand it. They didn't take neurology in school. I did. There are kidney doctors, nephrologists. They can look at the kidney with an ultrasound. They can look at the bladder with an ultrasound. They can take an x-ray. They can take an MRI. They can take a CT scan. They can do a cystoscopy. And yet, if they don't find that there's a serious infection in the kidney with a urinalysis, what else can they do? Maybe they can give you a stimulating device to try to override the mechanism of the nervous system triggering the bladder to go into bladder spasms. We'll talk about that in a moment. But without the electrical device that they can implant into your body, there may be no relief. Even with that electrical device, that stimulating device that they can implant into your body to try to override the nervous system stressing the bladder, even with that, you may now get no relief. You've got to understand there are mechanisms that are taking place, and there are causes of these abnormal mechanisms taking place. We'll talk about that in a few moments. Me making this video for you, there's a few points I'm going to make here. Number one, I am looking to help you become my patient here so I can give you a different service, something that can really help provide you relief, like what Cindy finally found after 23 years of suffering with her interstitial cystitis, an overactive bladder condition that caused depression, that caused her anxiety, that caused her insomnia, that caused her to not be able to sustain certain relationships, stress with school, stress with work, stress all around her life, because everything was focused on her bladder problem day and night. And you're going to hear her describe certain things in the testimonial at the end of this video about what she had to do in order to try to gain some relief. It drove her to, let's just say, prior to Care With Me, a very unhappy, a very insecure person she was, a very unhappy life. And now she has her life back. And she says she's got her life back by 100%, and her bladder is relieved by 80 to 90% after one treatment with me. So you're going to see her testimonial at the end. One purpose of my video is, I just want to repeat, I'm here to help you become an informed person and to really try to help you as a patient of mine to help you get rid of the causes. Yes, get rid of the causes of your condition, because that's the only way that you can actually find relief from your condition. And those causes can be infections, and there can be toxins that exist in different parts of your body that will cause your bladder to not feel well and not function as it did years ago. Whether it's a weak stream, whether it's incomplete emptying of the bladder as you think what you're feeling, whether it's burning and pain as you're voiding, whether it's burning and pain and cramping and stabbing, even without going to the bathroom, that may not even get relief when you do try to go to the bathroom. We're going to talk about all those points in just a moment, okay? So one point is to help you become a patient here. The other point I'm going to do is I'm going to share with you, or the other part of this video, I'm going to share with you the exam findings I discovered with Cindy when we provided safe and effective quantum energized formulas that would neutralize those different infections and toxins that I'm going to reveal in just a moment. When we helped the body neutralize those different infections and toxins that caused her condition, she finally, after more than 2 decades, she finally doesn't suffer from insomnia. She's no longer depressed. She's no longer anxious. She's not dealing with her bladder problem in anywhere near the amount of trips to the bathroom and the pain anymore. Keep listening to this video. Keep listening. She's not 1 in a million. Well, she is 1 in billions. But this result that she's gained can be reproduced for you, whether it's as fast as she's gained, or it may take more time. I'll talk about that in a few moments as well. After I share her exam findings and give you such a different point of view, I'm also going to make a free offer for you. We'll talk about that free offer at the end of this video. And then after that free offer, okay, and helping you understand how to become a patient here, you'll get to see her full testimonial unedited. All right, let's get into her exam findings now. The first time I saw her, and she was referred by another very, very happy patient who referred Cindy here and said she thinks that Cindy's only chances with this work that I offer. Okay, so the first time I saw her was January 12th of 2023, and the second exam, where she already had relief and the testimonial was filmed after the second exam, but before her second customized protocol, I saw her in July 6th of 2023. Let's talk about her first exam findings. First of all, I found that part of her shortness of breath was caused by she had infections of viruses, influenza, Epstein-Barr viruses, and certain chemicals from, let's say, vaccines that had been administered to her that were also causing a toxic effect, in addition to the infections in her lungs and respiratory tissues that I discovered with my unique exam process. I also found that these different shots, the toxins of them, had been absorbed into the respiratory system. Your respiratory system, your lungs, are part of your detoxing system. Besides getting air in, you also release carbon dioxide. Your body can use this channel of your respiratory system to try to release other toxins like chemicals from vaccines or mercury or anesthesia chemicals. The list goes on. I won't get too deep into that right now. I found that her bladder also had the measles virus. Yes, her bladder also had chemicals from those shots, although these shots were not what started the problem, but they added more fuel to the fire. I found that toxins and infections I found in a study of her saliva. Yes, I studied her saliva, and I found her saliva was, let's just say, infected and toxic. It didn't look it, it didn't smell it on appearance. It looked clear, but my study, I found different germs in there. It's common to all humans. There's no way around it on the planet, really. But when we swallow water, for example, where does the water go? It goes to hydrate every part of your body. You swallow it, it goes to your stomach, it gets into your intestines, it's absorbed into your bloodstream. The blood carries the water to your brain, your skin, your breast tissue, your thyroid, your bones, your muscles, your lymph, your organs. All of your body needs hydration, even the tissue underneath your skin, even your blood vessels, all parts of brain and spinal cord. Every part of your body needs water. When you swallow the water, you're swallowing saliva. Wherever the water goes, your saliva goes. When your saliva is carrying infection, guess what happens? The saliva will carry, or the body will carry, the infected and or toxic saliva to different parts of the brain and the body, and that saliva becomes deeply embedded into tissues of the brain and the body, and then we have other inflammation reactions that can take place and other pain disorders that take place, and frequent trips to the bathroom can take place, painful frequent trips to the bathroom. So we found that the infections and chemicals from the saliva was also deeply embedded in her bladder, in her urethra. I found her bladder also infected by a group B streptococcus bacteria. that did not show up on a urinalysis, as she told me. I found, furthermore, that her ureters were infected with a Epstein-Barr virus. Her ureters, which are tubes that connect the kidneys to the bladder, the ureters are also infected by the measles virus. When the ureters are infected, the ureters can send stress signals constantly, to the brain, but also down to the bladder and cause the bladder to go into a spasm. When the bladder goes into a spasm, what happens is the bladder can't evacuate the whole bladder. Think of holding a new ketchup bottle that has a little hole at the tip. When you squeeze that plastic ketchup bottle, you're able to squeeze it, and now the ketchup comes out. Think if there's even no ketchup in the bottle to come out when you're squeezing, but you keep the squeeze on. You keep stimulating that bottle with your muscle contraction. Think of the brain telling your hand to squeeze that bottle. Think of your brain constantly telling the bladder to be squeezed and in spasm. It makes the bladder hurt. It will make you feel like you've got to pee, like you're not emptying the bladder, even though you have emptied the bladder. So we'll talk about that in just a moment, about what can get into the brain and make this irregular neurogenic bladder reflex, nervous system bladder reflex occur. I found also that the nerves, we're going to show a picture of where this comes out of your spine. You have nerves that come out of your lower back lumbar area, lumbar, low back spine. You have nerves that go down your leg, like the sciatic nerve. Those nerves that go down your leg don't go to the bladder. You do have nerves that come out of the bottom of the spine called the sacral area. You have nerves called the pudendal, or nerve called the pudendal nerve, that goes to the bladder. Pudendal nerve, it does go to the bladder. What would happen when the pudendal nerve is carrying an infection? Whether it's mold, whether it's candida, irritating the nerve, irritates the bladder. You can have bladder symptoms even when there's no infection in the bladder. Clear out the infection from the pudendal nerve. It calms down the nerve function. It calms down the bladder symptom. There's another group of nerves that comes off your spinal cord. These nerves, if we look at the spine, there's nerves that come out of the front of the spine. So the lumbar nerves that go down your leg, they come out of the sides of the spinal cord. We have nerves that come off the front of the spinal cord in the mid and lower back area. This group of nerves is called the hypogastric plexus. The hypogastric plexus, we'll put the words up here, the hypogastric plexus. You're not a neurologist, you're not a urologist, you're not a kidney doctor. I'm not trying to make you into one. The goal is to get you to understand more. You could rewind this video and play it again. Okay, so please don't feel overwhelmed when you're listening to my description. Just understand we've got to look at this from a whole different point of view than what you've been through before with your doctors if you want relief, okay? So listen up. The hypogastric plexus is a group of nerves that comes up below your stomach in the abdomen. It comes down to the bladder. It holds onto the bladder. There are doctors who do hypogastric plexus nerve blocks for overactive bladder and interstitial cystitis, well, for overactive bladder, let's put it that way, to try to calm down the frequency and the urgency that people suffer from with overactive bladders, and even maybe with incontinence. They'll try that. But the nerve block is toxic. The nerve block gets absorbed into tissues like the kidneys. It can cause back pain. It can go to the bladder and paralyze the bladder, really. And also what can happen is it doesn't stop the viral or the fungal or the mold or the bacteria, the parasitic or the toxin that's on the hypogastric plexus, or the group of nerves going down to the bladder from the spine. What happens is you don't get rid of those with the nerve block. What happens is those infections and toxins still exist on the nerve, and then you still suffer with your frequent trips to the bathroom and bladder pains. I found, back to Cindy's findings, I found that she had multiple different toxins in her kidneys, what caused her headaches. Yes, kidneys help regulate blood flow to the brain. Kidneys help you regulate blood flow and blood pressure to the brain. When the kidneys are toxic, which doesn't show up in a regular urinalysis study, when the kidneys are toxic, it can cause head pain, but also causing back pain, and also the kidney is strained and it can reflex a stress signal to the bladder, making the bladder go into partially a spasm. I also found she had terrible old vaccine chemicals in the kidneys. I also found that the hypogastric plexus that I just gave you information about a moment ago, the hypogastric plexus had a large amount of mold on it. How do you get mold in your body? Whether you're living in a moldy environment, or maybe when she was a kid in school, in elementary school, and she drank from a water fountain, what if there was mold in the water line, really? Mold in the water line back then when she was 5 years old. 6, 7, 8 years old. She drank water in a water fountain at school, and the water had mold in it, and the mold got in the body, and now the mold spread around over the years and continued to cause her this terrible pain, terrible stress to the bladder, terrible bladder cramps, and terrible urgent and frequent trips to the bathroom. That doesn't mean that that mold on that nerve caused the irritated ulcer-like inside of the bladder. We'll talk about that. I already mentioned a few findings a few minutes ago. We'll talk more about that as we go along in this discussion. Her pudendal nerve had mold. I found that there were multiple infections vaginally. There was no odor. She was not complaining about a vaginitis type of symptom, but there were infections vaginally as well. As well, I'll tell you that what I test with women is that there are times that their partner, their male friend, their boyfriend, fiance, husband, it's possible that the male in the semen is carrying certain viruses or bacteria or mold or a parasite or a fungus, and the man doesn't feel anything. There's no symptoms in their scrotum, there's no rash, there's no irritation, there's no swelling, there's no burning, there's no discharge, but the semen can be carrying some germs, and when, of course, through intercourse, when there's any release of that semen into the woman's body, the germs spread around into the vaginal area and can even go up through the urethra, and now cause other problems in the urinary tract. I found some of that with Cindy as well. And she's no different than other people. She's a very clean, educated person, by the way, okay? Germs get in people, toxins get in people and cause problems, and it's not her fault. I also found here that her endometrium and her cervix, there were different viral Epstein-Barr virus, measles, influenza, and different fungi, candida, in the cervix, in the endometrium, okay? I found that the liver also had fungal infections. I found that the ovaries had fungal infections. I even found her lymphatic system, which the body depends on a clean lymph system, to be able to help detox and disinfect the rest of the body. And think of a domino effect. When one domino falls, they all fall, right? So what happens when the lymphatic system absorbs, it's dealing with trying to get rid of a virus like measles, or trying to get rid of even with somebody who had a measles vaccine, yes, carries the measles. What happens when somebody has Epstein-Barr virus in the lymph? What happens when somebody has a mold or mycotoxins, mold toxins in the lymph? What happens when somebody's had dental work done and the anesthesia that was injected into the mouth? I am not knocking a dentist. I'm not saying to not use anesthesia. You have to for a dental procedure. This is not against the dentist, not against you getting a dental procedure, this statement. But what happens when they inject your mouth with a numbing chemical and that numbing chemical gets absorbed into your lymph and the lymph is not strong enough in your body to process it and expel it from the body? Your first domino falls, the lymphatic system is stressed, a domino falls, so to speak, and now the nervous system and your urinary tract and your kidney system and your organs and any part of the body can have a symptom, can have a malfunction because of a toxic and infected lymph system. So we help to clear out certain things from her lymphatic system. I found also that parts of the brain were also carrying around viral infections like the amygdala and the cingulate gyrus and the frontal lobe, which also helps to regulate bladder function. When somebody's anxious, let's say that somebody was driving their car, they're calm, heart rate is normal. Heart's a muscle too, by the way, that gets told what to do by the brain, although it does work on its own after it starts up, but the heart is influenced, its rate of function is influenced by brain. So what would happen if somebody was driving along on their highway, everything is fine, there's barely any cars around, they're relaxed, it's a beautiful day, they're off, they're on vacation, everything is great, and some person driving another vehicle drives up behind them and starts honking the horn and flashing the lights and starts really applying pressure to them, and now comes around and gets in front of them and steps on the brakes. Do you think that person who is driving along calmly is going to start to get very stressed and anxious, perhaps, or mad or angry? The heart rate goes up, blood pressure goes up. So we can change heart muscle function when the brain is stressed. Guess what happens when parts of the brain, like the amygdala, which causes fear, panic, anxiety symptoms when it's infected and toxic? What happens when the cingulate gyrus, another part of the brain that controls emotions, what happens when infection gets up in there? they can cause anxiety and or depression symptoms or sadness symptoms, but also those parts of the brain control muscle tone. What happens when the brain gets infected is the brain gets stressed, and it can drive a signal down to the bladder and make your bladder have a contraction or have a spasm that never lets up, because the brain is toxic and or infected. And you don't even have to have a fever. You don't have to have a headache. You don't have to have any throbbing pain in your brain. And the brain is stressed by an infection and or toxin, and it causes the bladder to go into spasm. The doctor can do a cystoscopy and not see anything wrong. In her case, Cindy, there was. But still, the bladder can look fine. The bladder is overactive. The person has pain all the time. It's because the brain is infected. And when the brain's infected, it causes a constant spasm signal to happen down in the bladder muscle. I found different Lyme disease bugs in her spleen and a few other parts of her body. I found some other parasitic infections as well. Her first protocol that she completed, that was customized for her from this exam, lasted more than 150 days. Yes, 5 months, one exam. It was a process for her to go through. She's happy now at the end. It's not always so easy coming out of symptoms, because there could be multiple different pieces of the puzzle that made one person sick and dealing with symptoms. You could have two people with interstitial cystitis, two people who have very similar presentation, both female, same age, same part of the country or part of the world that they're coming from, similar upbringing perhaps, and they have same diagnosis, they have frequent trips to the bathroom, almost the same pattern, yet one person may have root canals, and they may have mercury fillings in their teeth, and they may have had surgery a few times for taking out their tonsils, or a gallbladder had to come out, or an appendix had to come out. The reason why I'm bringing this up is, and you can see on the dental page on my website, I give a lot of examples, pictures and video, showing what I have found under crowns and in teeth. What if person A with the interstitial cystitis has infections in the mouth, an abscess in the mouth, without even knowing it's there, symptom-free in the mouth, or they had a root canal, there are 5 root canals, or they had wisdom teeth pulled and there's infection and there's toxins in the mouth, as well as they had surgery. These toxins and these infections from the mouth and toxins from surgical procedures stay in the brain and the body, and they lead to symptoms that can also result in bladder problems. Person B, same symptoms, but never had any dental work done. Clean, no infection, no root canals, no fillings, never had a cavity, gets dental cleanings every 6 months, brush and floss and water pick and everything, and their mouth is clean. No even gum disease. There's nothing wrong there. That's definitely pieces of the puzzle that we don't have to put together, because they're not part of this whole picture. You understand what I'm saying? That person never had surgery to put them to sleep, for a gallbladder or a tonsils or appendix or some other procedure, colonoscopy, anything. They never been put to sleep. So there's different parts of one person's puzzle that we have to put together, and different parts from another person. So Cindy, we're grateful and very happy for her that she, gave us a chance to help her finally come out of this terrible 20-plus year nightmare that she was living with 40 doctors who could not provide her relief, and we did in one treatment. You've got to see this from another point of view. You've got to. And so Cindy got better in one protocol that was customized for her, and there's another patient that may take 2 or 3 or so different exams and treatments, because some people just have so many pieces of the puzzle that we've got to start to put together to stop their symptoms. If you were in a rowboat, and that rowboat had one hole at the bottom and the water's coming in, you're going to sink if you don't plug that hole up and stop the water from coming in. You got to plug the hole. You can't just take a Dixie cup and try to empty the water and think you're going to not sink. Okay, so plug the hole in one rowboat. Let's say you're in another rowboat and there's 18 holes in the bottom of the rowboat. You plug up one hole, the boat's not going to keep afloat. It's going to sink. You understand? You got to plug all the holes. You got to make sure there's no leakage in those holes. Otherwise, the boat's going to sink. The point is, you could have multiple different infections in your brain, in your spinal cord, in a part of your brain stem called the pons. In a part of your brain stem, we have a part of the brain stem called the pons that also controls the bladder reflex. Okay, so is it in the brain? Is there infection in your meninges? Is there infection that's in the brain stem? Toxins in the brain or brain stem? Are there infections that got in the spinal cord? Toxins in the spinal cord? Are there infections on the hypogastric plexus? Are there infections that go on to your pudendal nerve? Are there toxins and infections in your kidneys? Are there toxins and or infections in your ureters, in your bladder sphincter, in your lymphatic system? This is the way we have to look at it. We have to be able to see from a whole different point of view and get insight there, which I do with my work on my website, and give discussion about some insight about how I do what I do. Not completely, but I'll tell you there are different environmental stresses. There are different environmental stressors like pesticides and weed killer spray and other things. There's a page on my website, the environmental stressor exam that I do. There's different senses in the environment. Epigenetics talks about the different environmental stimuli that makes disease occur in the human cell, from foods to smells, to images, to thoughts, to words that we speak. Look at my emotional page on my website. Look at the environmental stressor page on my website. Look at the food analysis page on my website. Look at the dental analysis page on my website. There's a lot of different steps that you'll see there, but there's a lot of different steps that I don't reveal in these videos that I'm putting online. I'm just telling you there's a whole different point of view, and Cindy is living proof that you can. She did, and you can overcome your condition. And I hope for you it's going to be very quick like it has been for her, but maybe it's going to take some time. We have to see it through, and you will get there. Okay? I'm devoted to helping you find relief, and all my patients for that matter. When I got to re-examine Cindy, the next exam, I found other infections that were in the stomach and other parts of the brain. I won't get into all that yet. I am going to tell you that there are things like scabies infections that get into the body. They can not just be on the skin, they can go into the cervix, into the bladder, onto the nerves that control the bladder, into the brain, into different parts of your body. So there are different Lyme bugs, there are different viruses. I'm going to describe in another video when I get to see her again. After she completes this protocol, we'll be able to discuss more. Okay, so there was another exam that she is now under care with that's lasting her about 60 plus days of treatment. But there were still infections in her sinuses, in her spinal fluid, and other parts of the body that are contributing to the still remaining some of her bladder condition. But what a dramatic difference it's made. Now, my free offer to you is on my website. You can download my free ebook, your free copy of my ebook about how you can reverse seemingly incurable chronic illnesses with quantum medicine protocols. And healing can happen. Download the book, easy to read. Download and easy to read. Might only take you less than an hour to complete. A lot of big pictures, big font, easy to read. You have the right to choose what you want to do for yourself. You have to take control of your life, okay? I have a unique process and a unique insight to many different parts of the body with my studies in neurochemistry, immunology, endocrinology, neurology, and many other parts of the human body to help me understand where to look and what to do for someone and how to see the body in a whole different manner than what people are generally commonly taught and informed about, or let's say possibly led down the wrong way of a lack of good understanding. I'll put it that way. I don't want to bash any physician out there, but we've got to see this from a whole different point of view, folks. Antibiotics are not the answer. Maybe somebody got rid of a UTI with an antibiotic, maybe somebody with azo and they're willing to live with that. But I'll tell you, when there are bugs in the body, when they're living under your skin, when they're living in your organs and on your nerves, you got to find them and get rid of them. You have to. And laboratories, urinalysis, blood analysis, hair analysis, these different tests, ultrasounds, CT scans, X-rays, MRIs, they're not going to find these bugs that are on the nerves. We can with this system. It was based by years of research by biophysicists. Read my free ebook. This care that I'm offering you can help you get your life back. I hope it's going to be fast. I do expect you to get better. Just hopefully it's going to be fast, but it might take some time. I said that before. I'm just repeating that, okay, to get the point across to you. Just know that insurance companies don't recognize this work that I'm offering. You're in a contract with them, and they only pay for what's contracted with them. So this type of care that I'm offering you is an investment that you have to make in yourself. And we'd love to see you on the other side, where you're happy and smiling and willing to give an incredible testimonial like Cindy gave. That is my goal for you. Just know that the insurance does what you're contracted with them, or how their contract is set up with you. You know, if you had homeowners insurance and you don't have flood on the homeowners insurance and you get a flood, they don't pay for it. If you don't have fire and your house catches fire, they don't pay for it, but you still have a homeowners insurance policy. Your body is yours. You're living in it. This is your home. Doesn't matter about the car. Doesn't matter about the cruise. Doesn't matter about the home you're in. You're living in your body. It's time for you to take control, and let's find what's causing your problem and start to provide you safe and highly effective remedies or quantum energized formulas. We'll talk about that in my book. Talk about that also on my website, that will help your body neutralize these different offending agents and get you the relief that you want, that your family wants for you, that your friends want for you, that you deserve. It's time to get your life back. And I believe that I have a great opportunity for you to get it done as your physician. I look forward to helping you. You can call my clinic at 954-370-3100. That's 954-370-3100. You can also email my clinic. My assistant is very happy to answer your questions. So email is here on the bottom of the screen. Also, we have a frequently asked questions page on my website. You'll know where to fly to, which airport if you're coming from out of state or out of the country. We're right now in Southeast Florida. Not forever, but for now we are. And there's an airport, there's hotels that are right around us. All questions about your appointments, how long it takes, and so on. It's all there, very transparent on the frequently asked question page. The investment in yourself, all of that is on that frequently asked questions page. Very easy. I look forward to helping you. I believe that you can get your life back. I look forward to seeing you and making you into another incredible testimonial for me to share with the world. I'll see you soon. Bye. Hello, I'm Dr. Herman. I'm here with a great patient. This is Cindy. Thank you for getting on this video with us today. We're both down here in South Florida. My clinic here in South Florida at the moment. She lives down here, luckily for us, down here in South Florida. She came to me for care for a condition with her. We'll get into that in a moment, but she's coming in from a referral from another very happy patient. Your condition was interstitial cystitis. That's what you were diagnosed with. How many years did you live with those interstitial cystitis symptoms?
So I've been dealing with this since I was 8 years old.
Since you're 8 years old, Janet?
Since I was 8 years old with the symptoms, and was told it was just like recurrent UTIs up until I was 18, and then I was officially diagnosed with IC.
And how did they diagnose you with IC? What did they do? Was it a cystoscopy? Is that how?
Yeah.
Were there other procedures for them to diagnose it, or just the cystoscopy, they said you have this?
Just the cystoscopy, and they looked inside and they said that it was like textbook IC, which up at that point I had never heard of it before.
And the textbook being it was red, it was irritated. Did they say ulcers? How did they describe it?
It was very inflamed inside and red, and kind of like he explained as like just bare. Like it seemed like it was just very raw in there.
Got it. Other symptoms before we get into the results right now after one treatment. You had headaches?
Yes.
Were those for a very long time, or were those more recent in your years? Can I ask your age now?
I'm 31.
31, okay. So since 8 with the IC bladder problem, constant throughout life? Constant. And headaches for how many years?
It was probably within the last year that they became more prone.
More prone or more frequent?
More frequent.
More frequent. And so before that, headaches were there or not?
Not as frequent.
Not as frequent. You had cramps in your calves?
Yes.
You had cramps and spasms in the fingertips and toes, right? And you had shortness of breath was another one of your symptoms, right? And another symptom, because of the interstitial cystitis, one of the other symptoms was insomnia. Yes. It kept you up at night.
Very bad.
Very. And also a troubled, even though you just got engaged now because you're better, but there was trouble in your relationship because you couldn't have intimate relations. It was too difficult, too difficult, right? Since you've been dealing with interstitial cystitis for so long, first, let's say, on a scale of 1 to 10, if 10 is the worst pain you can imagine with the bladder, and let's say 0 is no pain, what was it prior to coming in here?
It was like a 20. It
Like a
was
20.
like unbearable. Like I couldn't work. I couldn't sleep. I couldn't really like hold any relationships because it was just like a constant like dagger in my life that like wouldn't go away no matter what I did. Just like affected every area of my life really like dramatically. And it just like within the last year had gotten like 10 times worse. After I had a surgical procedure with a urologist in the area, that's when it got like completely unbearable. And really like 24/7, like it just never really went away.
And that procedure, I think you told me that the doctor who was rated as a top doctor in one of the top universities here in South Florida, right?
Yeah, she was recommended as like a specialist for IC, and we went there and saw her, and she recommended a surgical procedure, which she said she saw like ulcers inside my bladder, and so she was able to burn them, but that just like made it
worse.
100 times worse.
So if a 20 is the worst when you came to me of severity, what was it prior to that surgery?
Probably a 10.
It was a 10.
It was
and the
still,
surgery made it worse.
It was bad, but it was manageable with like medications, just like taking 𝐓𝐷𝐄 and other.
And the doctor who did the surgery, when you came out of the surgery and you said something's wrong, it's getting worse, what did she say?
She said we just had to give it time, that it could take up to 6 months for everything to heal. And I just kept calling her and telling her like it's just, I can't live like this, like I don't know what to do. And she's like, we have to give it time. I was taking 𝐓𝐷𝐄 like literally round the clock. I mean, like sometimes I would take a pack in like 2 days. And then I would start getting like really bad stomach cramps which is something that was really new, but like I started getting scared because I'm like, I'm taking all this 𝐓𝐷𝐄, I know it's not good. So then she recommended doing another surgery, and thank God I found you right before then.
Thank you.
Yeah.
It was a 20 when we met, and it was a 20 24/7, and now on a scale of 0 to 20, I guess we'll use 20 as the top, the worst. If 0 is no pain, and before we get to that number, what was the pain? Was it burning? Was it just an aching? Was it a squeezing? How did it feel? If you can give us the quality of that pain.
So it's mostly a burning, but it also does feel, I think, from that constant burn, it turns into like a frequency issue where you feel like you just have to go really, really bad all the time. But like even if you don't have to go, just burning and aching and just pain, like my whole like lower area is just felt like so sore, so like anything. I couldn't even like put anything near me because it was just like so painful. Even like water, sometimes if I would shower, like the water would hurt. It just felt like it was like the whole thing was just so inflamed.
You said even putting a tampon in during your period.
No, I couldn't. Like after that surgery, it was like I couldn't put anything down there. I was like, sometimes water would hurt. It was that raw. Like everything just felt like it was just like very, very irritated all the time, 24/7. When I would pee, it would burn. Like I would cry. Like I would literally sit down and just like cry every day. Like sometimes I would have to pee in like a really hot bathtub. It was the only way that I could like manage, because it was just like the worst sharp shooting pain. I don't know how to explain it.
You literally had to get into a warm bath and pee in there.
Yeah. Like
while you're in there, and then drain the tub.
Yeah, it was really bad. Like, and that you can't go to work like that. You can't like really do anything. Sorry.
You missed work a lot.
Yeah, it just takes a toll on your life, and it just like really becomes like the center of your life, and you can't like, there's nothing like to be told so many times like there's just nothing we can do, or like just have to wait. It just like then becomes like a mental thing where you're just like, I don't know if this is like ever gonna get better. Like it's very defeating. It's like a really mental thing too, because it's hard to like not lose hope and like believe that there's something else. But I had seen so many specialists at this point, and they've all told me the same thing, so you kind of just start believing it too.
How many different doctors or so-called specialists did you see?
in my lifetime, I don't even know, probably like 30, 40 different people. Everywhere in Boston, here, like in Tallahassee and Gainesville, like everywhere. It's like, it's just crazy that, you know, and I think the biggest thing is I feel like how you approach it is the way, like, I felt like they were always just really treating my symptoms. Like, I would get like bladder installations once a week where they would put like just like an anesthetic inside of me, basically, which is great for the hour, 2 hours, and you try to hold it in as much as you can, and then once you pee it out, it goes away. But I just kept telling them, like, but like, what's causing this? Like, I don't understand, like, how I don't feel like we're like treating like what's causing this. And they would just tell me, like, that's just how you were born, like, that's just what it is. And like, you know, it just seemed like it was like I had met my fate at that point, because I'm like, everyone's telling me the same thing. That doesn't, you know, I don't know, it was just something different that when I met you, I felt like such a sense of relief, because I was like, this is what I've been talking about. Like, I feel like there has to be something that's causing this, you know, and it doesn't make sense to me that all we're doing is just kind of like putting a Band-Aid on it, because it didn't seem like it was ever going to get better that way.
And now from a 20, what is the quality of the pain right now? What is the go ahead, I'll let you answer that. On a number, 0 is none, 20 was what you came in with.
I really feel like even when it does come, I mean, the frequency is just like night and day. Like, I can sleep through the night now. Even during the day when it does come, I was telling you, I feel like it's just maybe a 4 or a 5, maybe, but it's tolerable.
Maybe 4 or 5, so it might even be less when it comes.
Yeah.
And before it was constant, and now it can last for, you told me, I think at a 4 or 5, maybe 20 minutes.
Maybe 20 minutes.
And it goes away without an azo, without any other support, without any other med.
Yeah.
The nighttime, it was constant.
Yeah, that's the biggest thing. I couldn't sleep because I was just waking up every hour, having to go sit on the toilet, and like just even like I knew there was nothing to urinate, but I would just have to sit there and like make that force to create some type of relief. But I mean, I was up every hour. Now I can like just sleep through the night. Yeah. Like, the first time that happened, I was like, oh my God.
How many years?
I forgot what it's like to sleep 7-8 hours.
How many, congratulations, I'm happy for you.
Yeah.
How many years had you had that frequent nighttime urge to go, even when nothing came out? How many years has that been?
My whole life.
Your whole life, since you're 8 years old. So for 23 years of your life, as much as you can remember, insomnia, having to go pee, nothing coming out, pain, burn, urge, discomfort. Wow. What a difference.
It's crazy, because you get used to that. Like, it just becomes the normal. And now, like, I'm like, wow, this is why I was just constantly tired and constantly like felt so fatigued and like just exhausted, because I really wasn't sleeping. I never really was sleeping. It was just like little naps, and then even when you are trying to fall asleep, like, I don't know, you just know like what's coming. So it's just like every night I would get so much anxiety that, like, if I had like a really big exam the next day, or like I had a really big day at work or something, it's just like the anxiety too of knowing, like, here we go again, like, please don't be this bad this time. But it, you know.
But it just always was.
Yeah.
And now you have sleep.
Now I can sleep.
Now you can sleep, and you don't even need the extra aid to try to put you to sleep.
No.
Awesome. Congratulations.
Thank you.
It can happen for you too. Because what you said is they were just never looking for the cause. They said you're just born that way, and they just try to cover it up with some kind of anesthetic, but that was it, which makes no sense. Just makes no sense. So even the top urologist or kidney specialist or top interstitial cystitis specialist, so-called special, because if they were special, they'd fix it. They wouldn't be called a specialist by not getting your results. Got to get your results. So it's all about finding the cause and cleaning out your cells of the causes, whether they're viral, bacteria, fungus, mold, parasites, and chemicals that get in there, and so on. Now you told me you're able to have intercourse Because before, when I met you was 5 or 6 months ago, and right now this is July 17th, 2023. So I met you in the beginning of this year. It had been a year and a few, maybe about 15 or so months. You had no intercourse with your boyfriend, who's now your fiance.
Yeah.
After we've gotten you to this point, now you're engaged. So, but there was about 15 months of no sexual relations because the pain was...
It's just horrible. Like,
horrible.
It was just like the worst, like burning. It literally felt like sometimes I was like, there was like glass, like just like ripping. I don't know how to put it into like a good description, but it just felt so sharp and painful. And it's just like you can't, I mean, it's not enjoyable at all, but like even like afterwards, I would just like hysterically cry because it really takes a toll. It becomes something that's like a huge part of like your relationship. Like I mean, we had met maybe a couple months before, so it also like started really early on in our relationship. So it was like a huge just like, you know, thing for us to deal with at a very early on stage when we were dating. And it makes you feel bad, you know, you feel like it's like your fault, you know, but thank God, like he's very supportive and he's the best. But you really like brought that aspect of our relationship back where we feel like normal again. And like it's not like a whole thing, it's not a whole to do, it's not like this like really sad thing at the end and then, you know, he feels bad and everything. So
he thought, what about me before? I never met him.
Yeah.
Maybe just that one day on a Zoom video conference in the
Yeah.
background, but he thought what before you started care with me?
He was just like, what are you talking about?
What are you talking about? And now?
He really does respect you a lot.
I
And
appreciate it.
And he's very appreciative.
Yeah.
And he's a believer now.
Yeah. You're, I mean, I'm just so happy for you that you could sleep and you're not feeling that you're, I mean, from a 20 down to a 4 or 5, and that 4 or 5 is a short-lived experience. It went from constant at a 20 to a 4 or 5 that lasts for maybe 20 minutes when it does happen, and that's not even all day, and that's not at night at all. So if you can give a percentage, and you're still, because even before using 𝐄𝐍𝐿 and using bladder 𝐸𝐒, you still had the burning, you still couldn't have intercourse, you still had insomnia with the bladder 𝐸𝐒, with the 𝐄𝐍𝐿. So now you still are we're only after one protocol we're seeing these results, and she still has to take meds that weren't really helping her before, but they kind of cut the edge off a little bit, true? So, but it was still at a 20, and it was still constant, and it was still insomnia, and it was still frequency every hour, sometimes every 5 minutes you'd have to go back and try to pee again. Now that's stopped. So the meds that you were taking didn't really cut it. This did, or is doing for you. But if you're able to quantify in a percentage of, to say how much improvement at this point after just one treatment, and she's not every person. Everybody's got their own puzzle. Everybody's got their own unique thing that we've got to figure out. But for you, if you can quantify it from a percentage of improvement, is there a way could you put a number on it? Because the headaches are gone, the cramps in the calves are gone, the cramps in the legs are gone, the cramps in the toes are gone, the peeling skin on the fingers and toes on the feet is gone, cramps in the fingers is gone, the shortness of breath is 50% reduced. You can have intercourse, now you got engaged, now you're smiling, now there's no insomnia. From the whole body, if you can give a percentage of a quantification of you know, if you could say I'm this much better, but also for the bladder itself, for the people out there who are suffering. There's hundreds of millions of people around the world with bladder problems. You weren't the only one. You thought you were. You're not, and weren't. But because we can give a quantity for the improvement overall, and then a quantification for the bladder itself, just to think about that.
So I'm gonna try not to cry, but like, if you were to ask me about my whole life, I really feel like I'm like 100% better. And I'm not just saying that, but I feel like I got my life back. And like you said, like when you saw me the second time, I just feel like I'm like myself again. It just felt like for the months after that surgery, I just like, I was depressed. I was like so anxious. I just couldn't like sometimes get myself out of bed. I felt like I was gonna lose my job, my relationship, like, and I really mean that. It really was like taking over my life, and I didn't feel like myself, and I feel like I do now. So I really feel like Even like the little bit of pain that's like, it's not even pain anymore. It's like honestly just like a discomfort here and there. That may be at like an 80-90%, but I just feel like overall, like I feel like a new person.
You feel like a new person. So that's like 100% to be a new person.
Yeah, I really do. I feel like I have my life back. I'm happy again. Even when I do feel the discomfort, I'm like, it's okay. It's just 20 minutes. It'll go by and then it'll come.
And that bladder is, when you said it's just like 80-90%, you're talking bladder, you feel better 80-90%.
Correct.
Is that what you were saying before?
Yeah.
80-90%. Congratulations. I can keep digging in because I just love these details. It's phenomenal. I'm so happy for you. And I'm so happy your friend told you to come here, and she's happy for you. And the other person you referred in here is pretty happy because her with the headaches, that's, from what I've heard, is she's doing phenomenal, the migraines. Is there anything after your next protocol, and we expect more improvement, it may just take this next one or even one more after that, but you're going to be clean, you're going to be fine. It's all going to go away. So completely, 100% with the bladder. So is there anything for any person who's out there who's still, after hearing you and watching you, saying, well, maybe it's too good to be true, maybe just her, not me? Is there anything that you could tell somebody out there who's listening, who's been through it all like you, who just says, you know what, I don't think how could he do it? He did it for her, but all the practice, you've been to over 30, 40 doctors who couldn't do it for you. Is there anything you could tell them to maybe help them realize?
I just feel like
I'm sorry to interrupt, because when we were going on through that first exam, I remember with you, when you saw the method and you saw the strategies and you could see, oh my God, I see how it's going to help me fix myself. Yeah. You remember that, and you just looked like this, and you started crying on the table. This is what I've been looking for my whole life.
Yeah, that's what I was going to say. I just feel like this approach is so comprehensive, and I love how you like take into account like every aspect of your life. Like I feel like it's so personalized too, which has also been like actually easier for me. Like my whole life I've been told there's like IC diets, but then like you go online and you look and like one thing contradicts the other thing, and I love how here it's so personalized. It's not like you were saying like I was taking certain pills to like counteract the acidity, which is what I thought was like hurting me from certain foods, but it wasn't even that. So it's like it's something that is going to be so personalized to you that I think is going to make such a big difference so fast. In my opinion, I think that's what really like got me better so fast, is like I think you looked at my whole life and like even like just
from emotions, dental,
how
diet,
you feel about it,
your functioning of every part of your body, if you remember that.
Yeah, like,
and even now with the sense of smell, which was pretty interesting to you.
Like everything. It's just it's amazing how much like little things that you don't even think about may be hurting your body and you don't know. Mm-hmm. So I think that this way it really is like getting down to the root of what's causing this whole thing, and I trust it wholeheartedly, and I would tell you to just do yourself a favor and just come in and like don't listen to what other people say, even if they tell you that you can't be healed. Like advocate for yourself, believe it, because I mean I'm like a proof that it can happen.
You're almost like dumbfounded that you've really come to this final conclusion that it's real.
I mean, I'm just happy I didn't give up, and I'm happy that I like kept trying and I found you. Thank God.
Thank you. I'd ask your permission, number one, for the exam findings that I discovered from the first one. I can merge those. You know, I do my videos. I can put that in. And also, I do look forward to sharing with you when she is 100% better with the bladder, which is what I'm expecting, not hoping, but expecting to happen for her with this care, that we'll be able to share that news with them too. All right. Thank you so much. I appreciate you.